So why firearm violence? I just want to contextualize this for you. I tried to approximate some dates here. If we think about deaths by tornado, which gets a lot of media attention, in the past 300 years, we've had about 20,000 deaths. Deaths by hurricane, in the past 70 years, we've had close to 1,500 deaths. Deaths by gun, in approximately 30 years, we've had over 800,000, and we're well over 900,000 now. So when we think about how we pay attention to natural disasters or man-made disasters or societal disasters, this helps place firearm violence within the broader context. So we're talking about the intersection of policy, science, and politics. We are all scientists, we're clinicians, we're scientists. We focus on firearm violence as a health problem. It has tremendous policy implications, and it's also deeply affected by policy. And it's certainly deeply affected by politics. I'm going to tell you a story that we've lived through at Penn to really highlight the intersection of politics and violence. In the 1980s, the IOM came out with a report, Injury in America, that really recommended the establishment of a central agency to coordinate research efforts for injury prevention and control. And through a series of evolutions, by 1992, there was the National Center for Injury Prevention and Control established at the CDC. So that became the home for all injury and violence research. That was tremendously needed at the time. In 1995, we founded the Firearm and Injury Center at Penn. So Bill Schwab, who's in the audience, raise your hand, Bill, and I co-founded this interdisciplinary research to deal with the issues of firearm violence as we were living and breathing them every day in Philadelphia and throughout the US. And it was really at the height, I would say, of interpersonal homicide that we were seeing with guns. So we founded that in 1995. It was great timing because CDC had just committed to focus on injury and violence as a federal funding agency. Also in 1995, so now it wasn't such a good time. So what came out from Congress was that none of the funds made available for injury prevention and control at the Centers for Disease Control and Prevention could be used to advocate or promote for gun control. CDC's funds may not be spent on political action or other activities. That had a chilling effect on how we looked at science, how we did science, how science was funded around the issue of firearm violence. In the New England Journal of Medicine paper, it was called a partisan assault on science, and it really was a significant threat to CDC. What drove this? It was a paper in the New England Journal of Medicine by Art Kellerman, Fred Rivera, and colleagues, and if you know the two of them, they are stellar researchers in the injury space, that identified that gun ownership was a risk factor for homicide in the house, in one's home. And for that reason, Congress came up with restriction on funding this, saying studies like this should not be funded. The Dickey Amendment was introduced by Congressman Dickey, and they removed $2.6 million from the CDC budget. It was the exact same amount of money that was spent on funding firearm violence research the previous year. So it was a significant cut. That funding ultimately was restored to CDC and the Center for Injury Prevention and Control, but it was targeted specifically for traumatic brain injury. So it could not be used for firearm violence. So traumatic brain injury is important, but it was a clear redirection based on this amendment. This is Congressman Dickey in the dark blue shirt and Mark Rosenberg in the light blue shirt. He introduced the amendment, and Mark Rosenberg was the head of the Center for Injury Prevention and Control at the time and lost his job over this. So this was 1995. The message that was sent and that was clearly received was that we should not be doing science on the topic of gun violence. And it didn't say we could not do that. It said we could not use findings funded by CDC to advocate for gun control, which is different than doing science on gun violence. but it was interpreted such that funding dried up. In the mid-2000s, the National Academy of Science came out with a critical review about firearms and violence. And in the red boxes, you can essentially see the outcome of this review was, we don't know much about anything, right? We don't know much about anything. We can't determine if these associations are causal. It's simply not known in light of the lack of evidence. So the effect on squelching science in the field of firearm violence really had an impact that really played out over the following decade or decades. The National Academy of Science in this report in the mid-2000s also talked about deterrence and defense, saying we should really figure out how to study is defensive gun use protective or put you at risk, right? That was an area of science that we needed to know. This is a paper from Penn that in a really well-done study looked at the link between gun possession and gun assault. Charlie Brownus, who's now at Columbia, myself, Dennis Culhane from Social Policy and Practice, Tom Tenhave, who is a fabulous statistician, and Doug Wiebe, who's on the panel today. It was funded by the NIAAA at NIH, and it was published in the American Journal of Public Health. Within days of this paper being released, you can see this is an article from the Washington Times. Our paper caught the eye of several Republican lawmakers who questioned whether the money at NIH should be spent funding firearm violence research. And they say they're also leery of NIH research relating to firearms in general, recalling how 13 years ago the House voted to cut CDC funding when critics complained that the agency was trying to win public support for gun control. It's almost as if someone's been looking for a way to get this study done ever since. Well, yes, because that's how we build new knowledge, and we do science, and we can sort of answer the questions that the National Academy of Science said were important questions to answer. The NIH response to this is all over our paper from Penn, was terrific, that this is a public health problem, that we have every right, it's of interest to NIH, and they were very supportive. But this, again, was problematic in terms of should we be funding this. The consequence of that is in 2012, the language that was restrictive for CDC in terms of funding firearm violence research now is applicable across Department of Health and Human Services, and now is in an NIH restriction. So, and the language specifically is none of the funds made available for this in this title may be used in whole or in part to advocate or promote gun control. And that, again, had a chilling effect on funding of science. In 2012, Sandy Hook happened. And people said, this is it. This will never happen again. We're killing 5- and 6-year-olds and first graders, and this will never happen again. Many of the people who do violence research got together, and many of our broader colleagues submitted recommendations to the Biden Commission, and these are the 2 recommendations that we sent to the Biden Commission and were included in the Biden Commission's report. And you can see they cited one of our papers, so Penn is out here in this space, and we looked at the major NIH research awards based on cumulative morbidity. So if we look at from 73 to 2012, cholera, diphtheria, polio, rabies, there's a total of slightly over 2,000 cases that had 486 NIH awards. Firearm injuries, there were over 4 million cases in the same time period with 3 NIH awards. So as we think about building science, building knowledge, funding is important to do so. The Biden report gave people hope that we would make progress. It had a short-term effect. The ban on restricting funding for firearm violence was lifted, and then it came back in 2014. And the Parkland shooting was just less a month ago. So we are still in the same place in terms of the intersection, I think, of politics and science.